Tebra has made it as easy as possible for me, and I couldn't be more grateful for them. The main reason why I became a psychiatric nurse practitioner was to help people. In a lot of ways, I wasn't sure what I wanted to do. Initially, I was a business major in college. It was one semester from being done, and my grandmother had terminal cancer. She was about to go to hospice, and I have a lot of family members that are doctors, nurse practitioners, therapists, physical therapists, and they were all taking care of her. I wanted to find a career that I would have some fulfillment in. So then I did the switch to nursing, and it was the best decision I ever made. Nursing was great. I worked bedside, but I always wanted to do mental health or psychiatry. So I chose to go to psychiatric nurse practitioner school because I wanted a little more independence, more autonomy, and also hopefully being able to make a bigger impact for people. So my name is Fabius Santos. I'm a psychiatric nurse practitioner. I also have my doctor of nursing practice. I started Optimal Psychiatry and Wellness. It is a psychotropic medication management practice. We do a little bit of therapy as well. And we see ages 14 and older. And we've been open for 5 years now in Perry White Marsh area. I felt like psychiatry was turning into rushed appointments. So like 5-10-minute appointments. And my goal is to hopefully improve that and try to give patients 30 minutes, 45 minutes to feel heard. And that was a big goal of mine to start my own private practice. And again, that has helped us scale from, me being a solo provider to now having 10 providers. No matter what, there's always going to be challenges and stresses in your life, no matter where you are. But also having Tebra helped quite a lot, because it was my EHR that really helped with the intake form, made everything more simple and easy and intuitive. So when I opened my practice, I was using another EHR competitor, and it was working okay, but I wasn't really happy with their intake process. And I felt that for me to really scale and grow my practice, I wanted to try a different EHR. And I had made a switch early on in my practice because I was concerned that if I kept the other EHR, that it was going to be a lot more difficult to move all my clients or patients from that EHR platform to Tebra.
So moving from a large hospital system, software system to Tebra was a very big change, but it was a nice change because moving from a big system, there's lots of different ways to chart and different navigations. And we would have classes and classes on how to learn how to navigate the system versus Tebra. It's like very direct to the point. You need to do a note, you just add note. There's not like 5 different ways to get to that same exact option. And I didn't feel like I would ever miss anything because everything was just right in front of me.
Tebra is like our Bible, actually. It's like our guide to our daily operation. It's a very transparent and very easy tool to navigate and to communicate with the patient.
The most impactful tools in Tebra is the ease of ordering lab work and not having to go through an outside source. It's all in the Tebra system, which is very nice.
In the mental health side of it, maybe people are depressed or anxious. They don't have time to fill out paperwork. That's like the last thing they want to do. For them, just to have the vulnerability or the courage to just reach out to you and try to schedule an appointment is important. So the intake process has to be almost simplified in a way so that they can figure it out, send all their information in. And for that's the first thing, is just getting someone on board. The whole onboarding process was the best part about Tebra. The other big part of it was e-prescribing was simple. You were able to find the medications. It's easy to find the pharmacies.
Tebra allows me to be able to send multiple medications, without going to do one after the other and save time.
At one point, we were really struggling with Google reviews. We weren't able to really facilitate them or get them. And Tebra has this, part of their platform is Google reviews or surveys. And that really helped us boost our SEO as well. But that really helped with our Google reviews. And now we've been able to get a lot more clients. Tebra helps my private practice grow by being easily scalable with the EHR platform where it's easy to navigate, the e-prescribing is easy to use, the intake process is easy to use, the e-labs, and really all the features work well together.
It's not daunting, it's straightforward, and the support, it's not like you're not waiting for over 24 hours to get help. There's always help right there with Tebra team. I know Tebra is a good EHR for whether you are just starting or whether you're already established.
The future of Optimal Psychiatry is exciting. I know we're going to go far because he's just been the best. He's really brought us so many places, and I'm just looking forward to continuing to help more people and just continue to grow.
My boss, Mr. Fabius or Dr. Fabius Santos, is one of a kind. His compassion, his leadership style, and his support for the growth of every provider. So it's always feels good to come to work.
I have a lot of aspirations for my practice. I think the biggest thing is, trying to continue to grow this one. This is like our central main hub. We have a big 4,000 square foot location, and trying to fill up all the rooms and making sure that we utilize the space well. I like being able to be in the office and being able to interact with everybody and making sure things are working well. But ideally, I want to keep expanding if possible. If I could describe running a thriving practice in one word, it would be gratitude.